Hello, this is Ramavath Abhilash. I'm a second year medical student. What is your name? Sure. Okay, what's your age? 21. Okay, today I'm going to examine your motor system. Is that okay with you? Okay. Okay. Can we start now? Yes. As we access the motor system, focus on body position, involuntary movements, characteristics of muscles, and coordination. Inspect the size and contours of muscles. When inspecting for atrophy, pay particular attention to the hands, shoulders, thighs, and legs. The spaces between the metacarpals when the dorsal interosseous muscles lie should be full or only slightly depressed. Atrophy of hand muscles occurs in normal aging. Now check the muscle tone. When a normal muscle with an intact nerve supply is relaxed voluntarily, it maintains a slight residual tension known as muscle tone. This is best accessed by feeling the muscle's resistance to passive stretch. Persuade the patient to relax. Hold one hand with yours and while supporting the elbow, flex and extend the patient's fingers, wrist, and elbow and put the shoulder through a moderate range of motion. With practice, we can combine these actions in a single smooth movement. To access muscle tone in the legs, support the patient's thigh with one hand, grasp the foot with the other, and flex and extend the patient's knee and ankle on each side. Note the resistance to the moving the limb. If resistance is increased, determine if it varies as we move the limb persist through the range of movement and in both directions. For example, during both flexion and extension, feel for any jerkiness in the resistance. Tense patients may show increased resistance. Now test the muscle strength. Normal strength varies widely. So, which standard of normal should allow for factors like age, sex, and muscular training. The patient dominant side is usually slightly stronger than the non dominant side. If the muscles are too weak to overcome resistance, test them against gravity alone or with gravity eliminated. When the forearm rests in the pronated position, for example, dorsiflexion at the wrist can be tested against gravity alone. When the forearm is midway between pronation and supination, extension at the wrist can be tested with gravity eliminated. Test elbow flexion, C5 and C6, biceps and brachioradialis. Ask the patient to push against your hand. Now testing elbow extension, C6, C7, C8. The muscle is triceps. Ask the patient to pull against your hand. Testing for wrist flexion and extension, C6, C7, C8 radial nerve. Extensor carpi radialis longus and brevis. By asking the patient to make a fist and resist as you press down. Now ask the patient to extend the forearms with fingers straight and palms up, then press the palms downward. In test grip strength, ask the patient to squeeze two of the fingers as hard as possible and not to let them go. To avoid getting hurt by strong grips, place your middle finger on the top of your index finger. Normally, it should be difficult for you to pull your fingers from the patient's grip. A finger abduction, a C8 and T1, ulnar nerve. Position the patient's hand with palm down and fingers spread. Instruct the patient to prevent you from moving any fingers as you try to force them together. Now test for opposition of thumb, C8 and T1, median nerve. Now ask the patient to touch the tip of the little finger with the thumb against your resistance. Testing for hip flexion, L2, L3 and L4, iliopsoas muscle. By placing your hand on the patient's mid-thigh and asking the patient to raise the leg against your hand. Testing for extension of hips. S1. Gluteus maximus. Have the patient push the mid posterior thigh down against your hand. Place hands between the patient knees and ask the patient to bring both legs together. For abduction, place hands outside the patient knees and ask the patient to spread both legs against your hands. For testing the knee flexion, L4, L5, S1 and S2 hamstrings muscles are involved. Position the patient's leg so that the knee is flexed with the foot resting on the bed. Tell the patient to keep the foot down as you try to straighten the leg. Testing extension of the knee. L2, L3, L4 and quadriceps muscles are involved. Support the knee in flexion and ask the patient to straighten the leg against your hand. Test foot dorsiflexion. Ask the patient to pull up against your hand. For testing plantar flexion, ask the patient to push down against your hand. Okay, now this completes your complete examination of motor system. Thank you for your cooperation.